punching a hole in a brick wall. Is it even possible?
Hey everybody, may I have your attention please?
How strong is the average brick? The average brick can handle anywhere from 1,500 to 3,500 psi of pressure, depending on what it's made of and how it's made. How strong is the average punch? The average professional heavyweight boxer can shell out between 1,200 to 1,700 pounds per square inch or psi. Mike Tyson's famous punches measured approximately 1,800 psi. That's almost 1 ton of force per square inch. With the forces involved on both sides, shouldn't the bones in the hand shatter on impact? Good question. One to which there is no simple answer. The amount of force it takes to break a bone depends on many factors: the age, the strength, general health, and location of the bone, just to name a few. Most importantly, the manner in which the force is applied plays an integral role here. If the force is applied horizontally, the result will be a transverse fracture. If the force twists a bone, you'll get a longitudinal oblique fracture. Under a compressive force, you will get a compression fracture. As I've said many times before, bones are great in compression, but they suck in rotation. So if you're going to punch a wall, you'll want to leverage the compressive properties of a bone and strike with proper form, minimizing the risk of injury and maximizing the damage. You see, there are two main factors that contribute to maximizing force when punching an object: rigidity of the striking surface and length of the kinetic chain involved in generating the power of the punch. Punching is like striking something with a string of spaghetti. The striking surface itself is relatively small, generally the flat surface of the second and third fingers, the proximal phalanx. This small striking surface is at the end of a linkage of segments that includes the fingers, the hand, the forearm, the arm, and the scapula. Each of these segments is connected to its neighbor by a joint, each a potential spot where force can leak out of the chain. To maximize the force when punching, all of the segments need to be stacked directly over one another, with each of the joints being held as rigid as possible. This arrangement maximizes the amount of force that is transferred through the kinetic chain to the point of contact. If all of the joints between the segments are locked, the segments behave as a column, which is extremely strong in compression. If any of the joints between segments are not locked, some portion of the generated force will be lost in a direction other than that of the punch. Optimally, the striker will maximize the striking force by linking together as many segments as possible between the ground, or their base, and the point of contact. The most power is generated when the segments are serially linked together, one after the other, from largest segment to smallest segment, with the chain of segments becoming rigid immediately before coming into contact with the target. Large muscle groups at the base of movement initiate the cascade, moving the largest body segments first. As the segments begin to move, they sequentially transfer their power up the kinetic chain to smaller and smaller segments with increasing speed. If all goes according to plan, both speed and power are maximal at the point of and the time of impact. But the numbers still don't add up. Even a well-rested Mike Tyson with perfect form might have trouble crushing a brick, laying on a flat surface to dust with a single punch. That's why people who aim to break the brick employ yet another layer of leverage, placing the brick against another surface or edge to concentrate their force on a smaller surface area. But what happens when the camera turns off? Do any of these people sustain injuries from this type of performance? Some common injuries that occur from punching brick walls include lacerations of the hand, fractures of the fingers and metacarpals, and dislocations of the hand. Obviously, bricks are hard, as are the bones of the hand. Skin, however, is soft, and when you smack two hard things together with a soft thing in the middle, the soft thing loses out. As mentioned before, most of the force on impact is concentrated on the flat surface created by the dorsum, or the top, of the proximal phalanges of the second and third fingers. To ensure that the phalanges strike the surface appropriately, the wrist has to be bent slightly towards the ground. If the striker doesn't get this angle just right, the bone will strike the brick at an angle. This is a problem because while bones are great in compression, they are not great when bent. Hitting the wall at an angle will change the force the bone experiences from a compression force to a bending force. This is the mechanism of injury that causes the well-known fracture of the fifth metacarpal, the boxer's fracture. This is a fracture of the end of the fifth metacarpal where the head of the metacarpal is pushed downward. Occasionally, if the wrist is angled too far towards the ground, the bending force may be applied further up the shaft of the metacarpal, causing a dislocation of the base of the metacarpal near the wrist. A carpal-metacarpal dislocation. But that still doesn't explain this.
Place a piece of paper on a wall. Punch it for 2 hours without stopping.
These people are training their bones by punching and kicking things that they know full well that they cannot break. In this type of training, the athletes are attempting to take advantage of something called Wolff's Law. Wolff's Law describes how bones respond to external stresses. It states that in a normal individual, bone adapts to loads under which it is placed. Bones that see an increase in applied loads will remodel themselves over time to become stronger, allowing them to resist similar loading in the future. The architecture of the bone then undergoes adaptive changes. First, internally in the trabeculi, and later externally in the cortical portion of the bone, which may become thicker as a result. Ongoing stimulus is required for continued remodeling and positive bone production, which leads me to my next question. Why should older adults exercise and perform resistance training? While increased stimulus is necessary for ongoing remodeling and positive bone production, the inverse is true as well. With decreased loading, bone remodeling slows and negative bone production occurs. The bone becomes less dense, osteopenia, and weaker over time. Osteoporosis, a form of osteopenia, is a common condition among the elderly that occurs as a result of decreased activity and lack of mechanical loading. Without mechanical loading, there are no signals to the bone to begin remodeling. One of the easiest ways to reverse this negative process is to use resistance training as a method to introduce load to the bone to stimulate the bone remodeling process. So, is it possible to punch a hole in a brick wall? I'm not sure about that, but there are a few things that you can do to maximize the chance that you could, or at least minimize the chance that you might injure yourself. Number 1, engage in weight-bearing exercises and resistance training to maximize bone density. Basically, everybody lift all the time. Your bone will respond by increasing its density and becoming stronger, more resistant to fracture. Number 2, have a well-balanced diet to ensure that you have the proper nutrients to optimize bone health. Key nutrients include calcium, vitamin D, phosphorus, magnesium, vitamin K, vitamin C, and vitamin A. However, as long as you are having a balanced diet of whole foods, supplementation is not really required unless you have a specific documented deficit. Number 3, increasing bone density is a process that takes some time. It does not occur overnight. Bone strengthening occurs when the process of remodeling occurs at a faster rate than the process of bone breakdown. Activity that might otherwise increase bone strength may result in weakening of the bone if it occurs more frequently than or causes more damage than the remodeling process can take care of. This is the mechanism by which stress fractures occur. This may have been a factor that played a role in Conor McGregor's recent tibia fracture at UFC 264. Then, as McGregor stepped back to throw a cross,
he needs some milk.
So, if you want to punch through a brick wall, now you know what you need to do. Thanks for watching. I will see you for rounds next week. And as always, that's been a word from Dr. Chris, not your everyday ortho.